All right. Hi, everyone. Can you hear me okay? I'm not used to doing microphones or podiums. So I'm so excited to be here today. My name is Kaiti Justice. I'm with the Michigan Public Health Institute. And I just am here today to talk to you a little bit about what we've been doing lately. So just some of the things I'll talk to you about today are how we got involved in the work that we're doing, about the Plain Community Health Consortium, a little bit about PCORI, a little bit about one of our PCORI projects, and then some project learning. So how we got involved. I'm with the Michigan Public Health Institute. We are a nonprofit. And so we've been working in genetics projects for years now, mostly about improving access to genetic services. And during one of our projects, one of our colleagues who's in genetics came up to us and was like, hey, so the Plain communities have a lot of unique needs that aren't necessarily being met. So we kind of took that and decided it was really important to learn more about that. One being in public health and just really wanting to help people, and then two, there was a personal investment. We had multiple people on our team with family members and children with complicated medical conditions. So the way we went about that is we just started trying to learn from people and get involved and hear from community members. We started going to attending community events, attending conferences. We had a Plain community work group. We did some reading, just really trying to learn from any community members and just what they had to say and what they wanted to share with us. Fast forward a little bit, we built some relationships and ended up learning about the Plain Community Health Consortium and joined them. So the Plain Community Health Consortium is a group of clinics and associate organizations who serve Plain communities. Their mission is to provide a forum to support member organizations in improving the health of Plain communities through collaborative research, education, and resource utilization. The clinics, they serve more than 6,600 patients annually from 47 states, 5 countries, and territories, and MPHI has been very fortunate to be a member of theirs, an associate member for the last 6 years. So now I'm going to switch gears just a little bit and talk about PCORI, so the Patient-Centered Outcomes Research Institute. They are an independent nonprofit, and their organization focuses on patients and their needs and preferences. They do this by making sure that patient and family voices, as well as others, are included in all parts of a project. For example, if a researcher was to go to a patient and say, hey, what do you think about this brochure? Maybe if the patients were asked at the beginning, they would have said, we don't actually want a brochure, we want literature on types of treatment we could get, or something like that. So PCORI funds research and engagement work that gets people information that they can use to make informed decisions and healthcare choices and, do what's best for their wants and needs. All right, so now I just want to tell you all a little bit more about the work that MPHI, my company, is doing with the Plain Community Health Consortium. We came together and put together this project and got funding from PCORI to learn from Plain families to see if they want to be part of a research team, and if they do, just what that looks like, what it should look like. So we put together a leadership team, which has community members on it, and staff from clinics on it who serve Plain communities, and kind of decided the best way to do that was to just go out and talk to people at events like this and just get opinions. So our ultimate goal is to learn how to help get Plain communities what they need so they can make the best decisions for themselves and their families. And we just want to understand the perspectives of Plain families to make sure that the people who are being impacted by research are also part of the decision making about research. So all this really just kind of means learning how to include community members so they're active participants in every step of a research project in a way that they want and in a way that honors their culture and their needs. So with all of that said, what I'm doing here today, I'm very, very thankful that we were invited to come and meet all of you and speak with all of you and have the opportunity to learn from you. Just kind of hoping to learn from community members if there's anything you'd want to share about what it should look like if you wanted to be part of a research team, if that's not something that you'd be interested in. And when we say research team, it's kind of like across that whole part, like how do you decide what's important to study, who should decide what, who should be talked to about different things, how you should go about learning things. Anything that you wanted to share your opinions on. I will be around all day today. Let me see. Yes. And we do have a survey available in the back if anyone's interested in filling that out, but I am also there to just talk if anyone doesn't want to fill out a survey and just wants to share like a couple opinions or anything like that. And then lastly, what I have for you all today is that we do have some money available to support Plain families' attendance at this event today. And you don't have to fill out the survey to do it or anything like that. It's just kind of a thank you to show, your value and appreciation. And we know it takes a lot of effort sometimes to come to events like this. So if you're interested, please also come and find me about that. And that's it for me.